Bringing together voices in child and youth healthcare. This is CAFC Presents.
CAFC would like to thank the following member organizations for their generous support of our knowledge translation activities: the IWK Health Centre, the Children's Health Foundation of London, the McMaster Children's Hospital Foundation, the Children's Hospital of Eastern Ontario Research Institute, the Children's Hospital Foundation of Manitoba, the Montreal Children's Hospital Foundation, and the Holland Bloorview Children's Rehabilitation Hospital Foundation. We would also like to thank the following Keystone partners for their ongoing contributions that support all of CAFC's programs and activities. All right, hello everyone, and welcome to today's episode of CAFC Presents. My name is Doug Maynard, and I'm the Associate Director here at CAFC, the Canadian Association of Paediatric Health Centres. And today's webinar is titled Practical Applications of Promoting Early Literacy in Health Settings, Connecting for a National Strategy. Actually, I think that's a remnant from last week's title. It was the practical applications part. It's just promoting early literacy in health settings, connecting for a national strategy is the title of today's webinar, although I'm sure the applications will be very practical. We have our usual excellent panel of presenters today. It's a great opportunity to showcase some work that's coming to us from our colleagues at the Canadian Paediatric Society. We've had a few webinars that we've partnered with them on previous ones on educational and other opportunities to support healthcare practitioners that are dealing with new immigrants and refugees new to Canada and other health issues that are unique to that population. So that webinar you can find on our Knowledge Exchange Network as well. So it's great to partner with CPS again. And before we get started, we're going to just run a couple of polls. So for those of you who have participated before, you'll know that this is just your opportunity to go up and click on the screen to make your choice. So we're just trying to get a sense of who's in the audience today. Just wondering if we have physicians, pediatricians, family doctors, for example, or any other physician, other health professionals, administrators, community literacy workers, or other. So if you can just let us know who's in the audience, and we'll close this off in just a second. So it looks like the majority are other health professionals at 41%, but we do have a large number of community literacy workers, which is great to see, at 24%, and 5% are physicians. We also wanted to know, does your organization, are you or your organization involved in an early literacy health project? Pretty split. 59% say yes, they are involved in an early literacy health project, and 41% saying no. And the last question is, what are you most interested in learning about today? Most of the people, 57%, looking for all of the above, but next to that is literacy promotion models at 20%, followed by resources, and then ways to work together in advocacy for a national policy. So, all right. All right, so now it's my pleasure to introduce our panel. We've got three great presenters today from different parts of the country. First up, we'll be hearing from Dr. Alyson Shaw, who's an assistant professor of pediatrics at the University of Ottawa and a consultant pediatrician in the Division of Pediatric Medicine at the Children's Hospital of Eastern Ontario, or CHEO, which is in Ottawa, Canada, where she's also the director of the Pediatric Medicine Ambulatory Clinic. And she's the chair of the Canadian Paediatric Society's Literacy Promotion Advisory Committee and a member of the Canadian Paediatric Society's Public Education Advisory Committee. And she often speaks on and writes about common parenting and early childhood issues. And following Alyson, we'll be hearing from Carol McDougall, who is the director of Read to Me, which is Nova Scotia's hospital-based early reading promotion program. And Carol has worked in the field of children's literature and literacy for over 40 years. And then following that, we'll hear from Jan Lariviere, who is a retired pediatric nurse and is currently the coordinator of the Lariviere Imagine Read Literacy Promotion Project at the Montreal Children's Hospital in Montreal, Quebec. And she's published research on the benefits of parents reading to their infants in the NICU and is a member of the Canadian Paediatric Society's Literacy Promotion Advisory Committee. So great panel, and it's now my pleasure to hand the virtual podium over to Dr. Alyson Shaw in Ottawa. Over to you.
Thank you very much, and welcome to everyone this morning. We're very pleased that you've joined us today as we talk about promoting literacy in the healthcare setting. Today's presentations will discuss why healthcare providers should care about literacy and the role we can play in promoting it. I'll review what doctors are beginning to understand about language and literacy development and the evidence for our role. Then you'll hear about how 2 children's hospitals are using different ways to encourage reading among the families they serve. Literacy influences health both directly and indirectly. It is closely related to nearly all the major determinants of health that have been identified by Health Canada. Low literacy begins in childhood and is associated with poverty and unhealthy lifestyle practices, such as smoking, poor nutrition, lack of seatbelt use, and a lack of breastfeeding. It is also associated with inappropriate use of medical services. Low literacy affects millions of Canadians. Literacy is a continuous developmental process that begins at birth and can be strengthened or weakened throughout the lifespan, depending on how well it's practiced and developed. Promoting literacy is therefore a key part of practicing preventive medicine. So how do our children fare? It's estimated that 5 to 10% of children have significant reading delays. In Ontario, where I work, 1 in 5 kindergartners show delays in vocabulary development, and a third of grade 3s don't meet provincial reading and writing standards. This is significant when you consider that children spend the first 3 years of school learning to read and the rest of their lives reading to learn. Let's talk now about how language and literacy develop. We used to think that children learned to talk at home, and then they went to school where they learned to read and finally to write, and we considered these to be separate processes. We now know that the foundation for language and literacy is laid far earlier, in infancy, and that these processes are all connected. The brain is not a computer. Nature doesn't cobble it together and then turn it on when we're born. The brain actually starts working long before it's finished. At birth, a baby's brain contains 10 billion neurons. Shortly after birth, the brain produces trillions more connections between the neurons than it ultimately uses. These are called synapses. In fact, for a 2-year-old, by the time a child is 2 years old, a child's brain contains twice as many synapses as their pediatrician. Synapses that are stimulated by frequent use during the early years are preserved. This is the process of stabilization. And those that are seldom used are eliminated by a process called pruning. Early experiences, especially everyday interactions with parents, like reading together, shape the brain architecture that supports learning in later life. What promotes brain development? Parents have been reading to children for generations, but now basic science backs up what Mother Goose and Dr. Seuss already knew. Early brain development happens through relationships, real back and forth, serve and return relationships with loving caregivers. It doesn't happen on screens. Positive interactions need to be repeated and reinforced to promote optimal neural connections. When this doesn't happen, brain development is impaired. Adverse events, such as poverty or poor nutrition or maltreatment, lead to toxic levels of stress that can also make it difficult for the brain to learn. Even a lack of stimulation can impair the formation of neural synapses. iPads and smartphones haven't even been around for 10 years, but it's a daily sight to see a parent gazing at their screen instead of their chubby-cheeked infant. We're only beginning to understand how these, quote, secondhand screens affect young children. But we do know that stress plays an important role in the development of both mental and physical conditions. The basic science is clear. During the first few years of life, stable, safe, and nurturing relationships promote healthy brains by decreasing toxic stress and encouraging foundational mental skills. As pediatric providers, we need to identify strategies to reduce toxic stress and mitigate its effects as early as possible before permanent damage is done. One of those strategies is to encourage parents to read, speak, and sing with their babies. We need to tell parents that reading aloud can help your baby enjoy time with you, practice language, and learn about the world. This love of books, language, and communication will help your child be ready to learn and ready to read when they start school. I like to imagine this pyramid of language and learning, language and reading. At the base, we have early language exposure. For most babies, this language environment is created by their parents and includes all the words and songs and rhymes that they might share. From that, babies develop language ability. Early language skills are based primarily on language exposure. We wouldn't expect a child who was never spoken to suddenly speak English when they turn 2. And we shouldn't expect a child who has never been read to be ready to learn to read when they start school. Language skills, like vocabulary and recognizing speech sounds, are at the foundation of early literacy skills, like being able to retell a story. So in the early years of children's lives, parents are their most important teachers, and the verbal environment they provide sets the stage for children's language learning. However, this linguistic environment varies substantially between families. A well-known study by Hart and Riesly looked at families from across the socioeconomic spectrum. Each month, until the child was 36 months old, researchers went into the home for 1 hour and recorded all the words uttered by parent or child. The results showed, not surprisingly, that children with greater exposure to language had larger expressive vocabularies. As well, both language exposure and the rate of expressive language development varied by socioeconomic status. When economically disadvantaged children were 3 years old, they'd been exposed to an average of 620 words per hour and could say 500 different words. In contrast, children from working class families heard about 1,200 words per hour and could say about 700 words. Economically advantaged children were exposed to more than 2,000 words per hour and could say 1,100 different words, more than twice that of children from the poorest families. This is what's commonly known as the 30 million word gap, and it's a sobering thought when 1 in 5 children in Canada live in poverty. We know from other studies that when activities such as playtime, mealtime, dressing, and reading are compared, the greatest quantity and quality of language interaction occurs during parent-child reading activities. Parents tend to use more complex and descriptive language and to ask more questions when reading aloud than they do during other daily activities. Unfortunately, 16% of parents with toddlers don't read with them at all, and 25% do so only once or twice per week. Even among college-educated parents, only 3/4 read with their preschoolers nightly. Children from low-income families are far less likely to be read to on a daily basis. A typical middle-class child enters grade 1 having been read to for approximately 1,000 hours, compared to only 25 hours for children from low-income families. It is said that books build better brains. That's because books promote high-quality, language-rich parent-child interactions. In fact, children's books contain more rare words than primetime TV or even college students' conversation. A book in the home is a prompt and an opportunity for serve and return interaction. When that daily parent-child FaceTime or lap time becomes part of their daily routine, children develop positive associations with books and stories. Through exposure to print and letters and story structure, they learn early literacy skills that help prepare them for school. The more often children are read to, the better their literacy development. And the better their literacy development, the more successful they will be in school and the healthier they will be in life. As healthcare providers, we have a unique opportunity to promote literacy. We are trusted advisors who have repeated one-on-one contact with families during years before their teachers do. Well baby visits may serve as the only source of formalized support for poor families. A U.S. national poll found that one of the areas in which parents most wanted information from their pediatricians was their children's learning. In fact, the word doctor comes from the Latin word that actually means to teach. Unlike school teachers, physicians see children during their first year of life, a period that's critical to brain development. Medical providers may be the parent's only source of expert information. This is particularly true for families living in poverty, who tend to lack access to formalized supports like preschool. Because physicians hold a unique position of trust and authority in the minds of parents, we can use our influence to convince parents of the importance of reading. Parents are more likely to read to their child if their physician or healthcare provider encouraged them to do so. The 2006 Canadian Paediatric Society position statement on promoting literacy in the physician's office states the following: the economic and psychosocial consequences of low literacy make literacy promotion a key part of practicing preventive medicine. Low literacy starts in early elementary school when children fail to read and write. Low literacy is therefore primarily a pediatric problem. Primary care physicians who have repeated contact with the family at an early stage have a unique opportunity to promote literacy. In a similar statement, the American Academy of Pediatrics recommends that pediatric providers promote early literacy development as an important evidence-based intervention at health supervision visits for children beginning in infancy and continuing right through until the age of school entry. Just a few years ago, asking a parent if they read daily to their infant or preschool would have been uncommon in a routine pediatric history. But talking to parents about reading to their children has now become the standard of care for pediatric providers. It is incorporated into the Rourke Baby Record, the U.S. Bright Futures Guidelines, the Ontario Enhanced 18th-Month Visit, and even Nelson's Textbook of Pediatrics, which is the Bible of pediatric medicine. This is an image from the Rourke Baby Record, which is a surveillance tool that is endorsed by the CPS, the College of Family Physicians, and Dietitians of Canada. It's widely used by primary care providers. It includes prompts for many areas of anticipatory guidance, including feeding, injury prevention, and child development. And since 2006, if you look right down at the very bottom, beginning at 2 months of age, there is this reminder for healthcare providers to encourage reading. So what does it mean to promote literacy for our patients? What is early literacy promotion? Well, it's not teaching babies to read. It's about teaching them to love words and to love books. The goals of literacy promotion are also parents who enjoy looking at books with their children and understand why reading aloud is important. We want parents who read aloud effectively to have fun and to build their child's language and pre-reading skills. And we want parents who feel supported by their physicians and healthcare providers in their aspirations for their child's cognitive development. What do we want parents to do? We want them to share good books, to engage their children in conversation around the words and the images, and we want them to do this daily, beginning from birth. I'm going to talk now about Reach Out and Read, which is an important literacy initiative that began in Boston 27 years ago as a collaboration between pediatricians and early educators. There are 3 main components to Reach Out and Read. The first is volunteer readers in the clinic waiting room who read aloud to children and model dialogic reading while the families are waiting for their appointments. Secondly, at every health supervision visit, children aged 6 months to 5 years old receive a new developmentally appropriate book, which is given to them by their healthcare provider. And finally, at each visit, medical providers encourage parents to read aloud to their children and offer anticipatory guidance about early literacy and school readiness. Through Reach Out and Read, by the time a child goes off to school, they have their own library of 10 quality books. And for many of the families who participate in Reach Out and Read, these are the only books in the home. Each year, medical providers at the nearly 5,000 Reach Out and Read program sites in the United States and abroad distribute 6.5 million books to children and invaluable literacy advice to parents. In our final presentation today, you'll hear how this model has been adopted at the Montreal Children's Hospital. With more than 14 studies, Reach Out and Read is the most cited literacy intervention in the medical literature. Altogether, there's data from more than 2,000 subjects across multiple populations and multiple study designs. The results of these studies consistently show that in populations at risk, clinic-based literacy interventions, like Reach Out and Read, where they give out books and advice to families, have a positive impact on family literacy. Participating parents report more positive attitudes towards books and reading. They are more likely to read to their children frequently and to report improved parent-child interactions. And participating babies even show significant increases in expressive and receptive language scores as preschoolers. All of these outcomes are linked, at least in theory, to the ultimate goal of literacy promotion and school success. The language studies are particularly important because preschool language ability is one of the best predictors of later reading success. Also, language scores are much less subject to bias compared to parents' self-reported attitudes and literacy behaviors. And they add weight to this evidence. There are some other interesting findings in the literature as well. Silverstein and colleagues showed that an English language program is effective for a multilingual population, which is very handy for us to know in Canada. Giving out books enhances the effectiveness of anticipatory guidance beyond what is achieved by the advice alone. This is probably because, compared to advice that may be forgotten or a pamphlet that gets shoved in the bottom of the diaper bag or lost in the parking lot, when you give a family a book, you are giving them a tool. The toddler will ask the parent to look at that book with them over and over, and every time they do this, the physician's message is being reinforced. This may also be why parents rate physicians who demonstrate reading aloud and give books as more helpful than physicians who don't. Finally, there's an important dose effect for the Reach Out and Read intervention. This means that the more visits families had where their doctor discussed the importance of reading and the more books they received, the more likely the parents were to read aloud to their children and enjoy reading together. Also, the more visits where literacy was discussed, the higher the expressive and receptive language scores for the preschoolers. We don't have time to go through the studies in detail today, but if you're interested in learning more about them, you can read about them at the Reach Out and Read website. The American Academy of Pediatrics and the Canadian Paediatric Society have similar recommendations for pediatricians. Both recommend that pediatricians counsel all parents about the importance of reading with their children as part of regular healthcare visits. High-risk, low-income children should be provided with a developmentally appropriate book at each well-child visit. And we should be working together with other child advocates to influence national messaging and policies. Some of the key messages we want parents to hear are, you are your child's best teacher. Talk to your baby even before he can talk. Sing and play every day, and make books part of your child's routine. I find that parents who generally wouldn't read for any other reason will read because it makes their routines, like mealtime, bath time, and bedtime, easier. Reading isn't meant to be a chore. It should be fun, and we need to remind parents of this. We also need to tell them that your child will love books because your child loves you. Looking at books together creates a special one-on-one time with parent and children that parents and children crave in today's busy world. To that end, in 2007, the Canadian Paediatric Society launched an initiative called Read, Speak, Sing, or Lisez, Parlez, Chantez. This is a program to help pediatricians and other health professionals encourage parents to read to babies from birth. Health professionals and parents can access a number of tools and resources to help make reading part of everyday life. All of these materials are available both in French and English. One of the resources that's available in the Read, Speak, Sing toolkit is a developmental milestone chart related to books and reading. The literacy milestones are consistent with other well-known social and motor milestones. For example, a 6-month-old explores by mouthing objects, so if you give him a book, he will put it in his mouth. And it's important to tell parents that that's okay, because first books are meant to be drooled on and devoured. That's why we try to choose cardboard books or bath books for them. By the time a child is 12 months old, she can isolate her index finger, and that allows her to point to pictures in a book, and that's when parents can really start having conversations around the images in the book. In the kit, there's a prescription to read. It says here, share a book with your child every night before bed, repeat daily, or for 20 minutes a day. On the flip side, there are tips for getting the most out of story time at different ages. There's also a laminated guide for physicians on how to promote literacy in their office and tips for making books part of the clinic visit. Also available is a special issue of the journal Pediatrics and Child Health. The whole issue is devoted to learning to read and what physicians need to know and do about children's literacy. The new Books Build Connections toolkit from the American Academy of Pediatrics also has age-specific online materials for parents, tips for pediatric providers, and links to websites and resources. In conclusion, books build better brains by fostering relationships. You take a child on your lap for some real face time and back-and-forth conversation. That's the kind of relationship that protects against toxic stress and helps healthy brains to develop. Good pediatric practice should include promoting books and reading aloud because those relationships are key to promoting good health. Healthcare providers can make a difference in literacy outcomes. Parents really do want information about giving their child the best start in life, and they will follow our advice. For children at socioeconomic risk, giving books helps overcome barriers. Leaving the office with a book in hand helps the parent to follow our advice. Reach Out and Read offers an evidence-based model of a low-cost intervention that can have a big impact. However, it's not the only way to promote literacy, and physicians should incorporate strategies that suit their particular practice and population. Thank you for listening. There's some resources you may want to explore later, and they'll be posted on the CAPHC website. Carol McDougall will now tell us how some of these strategies are helping families to embrace early literacy in Nova Scotia.
All right, and before we go over to Carol out on the East Coast, I just wanted to take this opportunity to remind the audience, if you do have any questions, don't hesitate to type them into the question box at any time. And if they are for Dr. Shaw, then we'll be happy to get to those at the end once the other two presenters are done. And if you have any questions for Carol or Jan as they're presenting, please just type those in, and we'll get to those in between speakers as well. So over to you, Carol.
Thank you. So I'm going to be talking about how we're putting the research and evidence that Dr. Shaw spoke about into practice here in Nova Scotia. Read to Me is a nonprofit, province-wide early reading promotion program that provides a bag of free books and resources at the hospital bedside to every baby born in Nova Scotia. Our mission is to motivate and empower every family in Nova Scotia to read, talk, and sing with their baby as soon as they're born. The program is funded through an endowment fund, which is made up of private and corporate donations, as well as contributions from the federal and provincial governments. The endowment provides sustainable funding for Read to Me, ensuring that it will be in place for future generations of children. Read to Me is run by a staff of 2 full-time and 2 part-time employees and supported by volunteers. The staff bring together skills in education, literacy, children's literature, plain language, and publishing. The IWK Health Centre in Halifax is the host organization and houses our provincial office. The Read to Me Foundation Inc. Board of Trustees oversee the endowment. Read to Me is delivered at all hospitals in Nova Scotia that provide maternity services. We deliver approximately 9,500 bags each year to babies at 10 hospitals across the province. Since the program began in 2002, we've delivered over 100,000 Read to Me bags and given out over 250,000 free, high-quality board books across the province. Behind every Read to Me bag is a complex system for the purchase, shipping, and warehousing of over 100,000 individual program components, the monthly assembly of bags, and shipping those bags, about 700 a month, to the 10 provincial hospitals. Once the bags are at the hospitals, they're delivered to families at the hospital bedside within 24 hours of the baby's birth. Staff go through each of the bag components and talk about how to use the books and resources. Each piece in the bag is selected or created to engage parents in literacy-based activities with their baby. Read to Me is non-didactic and celebrates the strengths that all parents have to bring to their baby's early language and learning development. At some of the hospitals, the bag is delivered by nurses or by ward clerks. Each component in the Read to Me bag is carefully selected and developed to support emergent literacy, vocabulary, print awareness, narrative skills, letter knowledge, and phonological awareness. All resources we create use clear language and are created to provide a high level of guidance without heavy didactic text. A carefully curated selection of books are chosen by a team of experts in the field of children's literature. We choose books with strong rhythm and rhyme, bright, bold images, images that encourage loving interaction between parent and child, and images that celebrate diversity and inclusion. The quality of the books is essential to the success of the program. When parents are given the right book for the right developmental period, the experience will be positive for both parent and child. Selecting the best quality books chosen by experts in the field is an important investment for an early literacy program. We change the books in our Read to Me bag every couple of years, and this ensures that parents who are coming back to have their second or third child receive a new Read to Me bag each time. It also ensures that the books continue to be fresh and relevant. Over the past 15 years, there's been a tremendous growth in the number and quality of board books for babies that are being published. Here are the 3 books that we currently have in our Read to Me bag. Welcome Baby is illustrated with Barbara Reed's vibrant plasticine illustrations, and it celebrates the joy of the arrival of a new baby. Play shows the importance of everyday play in learning and development. At the back of the book is a message for parents about the importance of play. And Baby Look is a tummy time book, which is printed in an accordion style, which can stretch out across the floor in front of baby during tummy time. Each of the books are selected to work well together as a set, each book building on the information we share with parents about what babies can see and hear, and supporting bonding and attachment. Every baby receives an invitation to join the public library. We partner closely with libraries, and connecting families to the library is an important link that strengthens the continuum of literacy support from birth to school entry. We have just a few minutes with each family at the hospital bedside, but once they're connected to their public library, they have access to wonderful baby programs, toddler programs, free books, CDs, and library staff who can help the families find the right books for their child throughout their preschool years. Connecting to the library helps parents establish a culture of reading in the home. We created the Read to Me Family Reading Guide, which hangs on the wall like a calendar and takes families month by month through their baby's first year with developmental information, reading tips, and book suggestions. We're in the process of expanding this guide to 18 months, and on the last page of the guide, parents will be given information about the 18-month Well Baby visit in their community. With all the books to choose from, parents are often overwhelmed at finding and selecting good books for their baby. So we created the Read to Me 50 Best Books for Baby booklet to help families find excellent books. The 50 Best booklet gives suggested books for each age and stage from birth to 18 months. Songs and rhymes help build the foundation of early literacy by supporting phonological awareness, encouraging active listening, and contributing to language development. We created a wonderful original music collection of songs and rhymes that parents can share throughout the day. To ensure the program is accessible to all families, we offer the Read to Me bag in English, French, Arabic, Chinese, and Mi'kmaq. We have a selection of dual language books in approximately 15 languages, and as well, we offer Braille and signing books for visually and hearing impaired families. An uptake study was done with families, and there was over 1,000 families involved in the study. It showed that families who received the Read to Me bag in the hospital spent significantly more time reading to their babies than those in our control group who did not receive a Read to Me bag of books when their baby was born. By providing free, high-quality books to families at the hospital bedside, we were able to increase language-based activities in the home in the preschool years. The study, published in BMC Pediatrics in 2012, concluded that Read to Me was an inexpensive, easy to administer, and effective intervention, which resulted in increased shared reading between parents and newborns. We recently conducted an online survey of families who received the Read to Me bag. Over 700 families completed the survey, and the response was overwhelmingly positive. Here are some of the things that parents told us. We spent months in the NICU, and having those books for us right away gave us something to do to bond with our baby. Getting books right in the hospital reinforced the importance of reading to my baby from day one. Sounds silly, but the bag is a reminder to read. Life is busy, and seeing the bag is a constant reminder to cuddle up together with a book. Creating a province-wide program that integrates literacy into healthcare for new families presented some challenges. One of the challenges, of course, was fundraising. We needed to find operational funding each year, well, we also raised money for the endowment so that we can ensure the program would be funded in perpetuity. Also, introducing literacy into maternal newborn care. When the program began 15 years ago, providing books at the hospital bedside was a completely new concept, and healthcare workers were sometimes reluctant to embrace literacy in their busy day-to-day care with their families. It took time and support from our provincial office for literacy to be fully accepted, but now it is seen as an important part of the maternal newborn care given to every new family in Nova Scotia. And one of the big challenges we still face is working in isolation. At present, there is no national network of health-based early literacy programs. By connecting across Canada, we can share best practices, resources, and research. To learn more about the Read to Me program, you can visit us at readtome.ca. We also have hundreds of book recommendation boards on Pinterest, and you can like us on Facebook for weekly literacy updates. Thank you very much.
All right, thank you, Carol. Great presentation. We do have a couple of questions come in, but I think they're largely directed at the full panel. At least I think the people asking would like to hear thoughts from the full panel. So I think we'll save those for the end. So why don't we just head straight on back west to Montreal, where we'll hear from Jan Lariviere, and we'll get your presentation through, and perhaps it might answer some of the questions that have been asked. But after that, I think we'll have an interesting discussion based on some of the questions I'm seeing coming in. So over to you, Jan.
Well, thank you very much. It's a pleasure for me to talk to you today about 3 of our literacy promotion programs at the Montreal Children's Hospital. As mentioned, your center may be quite different, but we hope that by describing some of the projects that involve literacy promotion in our health center, that we will give you ideas for yours. In 2006, we started Books for Babies in the neonatal intensive care. We also have a program called Lire, Imagine, Read in our ambulatory clinics. And finally, Biblio Express is a project for our hospitalized patients. I will briefly detail each of these. The goals of all of our literacy initiatives are to provide families with the information they need about the importance of reading to their children, and to also provide pediatric healthcare providers with the tools they need to effectively provide support for family literacy. Many of the young trainees who see families do not really have a lot of experience themselves reading to young children, and they need tools to help them. We also want to create a hospital culture that values and promotes the links between literacy and health. Books for Babies is a clinical nursing intervention in the NICU. I won't describe it in great detail here. I had the opportunity to study the effects of giving books to parents in the NICU to read to their infants through a nursing research fellowship. And the study that I did was published in 2011 in the Journal of Developmental and Behavioral Pediatrics, if you'd like to know more about it. The study showed that parents who were encouraged to read to their baby in the NICU said that it helped them to feel closer to their baby, and these parents continued to do so when they went home. I interviewed 60 families who received the intervention and 60 who did not 3 months after the babies went home. And the intervention parents reported both a sense of control, normalcy, and intimacy with their infant, and that they would not otherwise have known that they could read to their baby at such a young age. They were also reading much more than their counterparts. An example of a parent response was, I walked into the NICU and saw my baby attached to so many tubes. I told my husband I didn't know what to do, and he said, well, just talk to him. I told him I didn't know what to say. The nurse said I could read to him if I wanted to, and she gave me a book. I started to read, and then the words came. Our intervention includes giving a book. Unlike the Nova Scotia project, we have many titles, although they are all carefully chosen as well. Books are available in 26 different languages. There's a book plate inside each book. You can see here that the book plate is personalized with the baby's footprints, and the nurse who's giving the book to the parents signs her name and says that she's encouraging the family to enjoy a lifetime of reading. There's also a letter enclosed with the book that reinforces the nurse's words. The nurses have told us that they enjoy giving out a variety of books and trying to give a book to the parents that they will enjoy. The book is offered to families as soon as possible after admission to the NICU. We gave out about 400 books per year in the past, but since moving to our new hospital this past year, we expect to double that number because we've doubled the patient population. I'd like to point out one question that we asked parents was that if they'd been advised to read to their baby by any other healthcare professionals. In both our control group and the intervention group, there were really negligible numbers who said that somebody else spoke to them about reading. I'm pointing this out because many of these infants were really close to a year, or even some of them were over a year of age at the time of the interview. And these parents, again, will very likely not have started to read to their child if they hadn't started reading in the NICU. The next program I'd like to describe is our Lire, Imagine, Read project, which takes place in the ambulatory clinics. It is integrated into our Department of Pediatrics through the Social Pediatrics program, and the Family Resource Library, Child Life and Speech and Language Pathology departments, the volunteer departments are all involved in an advisory board. You'll see here our website if you'd like to learn more details about the project, but you could just Google Lire, Imagine, Read and you'll find out about it. The clinics that participate in the project are the Pediatric Consultation Clinic, the Residence Continuity Clinic, Multicultural Clinic, Neonatal Follow-Up, and Adolescent Mother-Baby Clinics, and our Child Development Clinic. We do not have this project active in the ophthalmology or endocrinology clinic, for example. It's really where a pediatrician or a nurse practitioner or nurse is seeing the child and the family. We give out about 3,000 books a year in our clinics, just to give you an idea. Just to describe in a little bit more detail our clinical intervention, it's really based on both the Reach Out and Read and the CPS Read, Speak and Sing model of literacy promotion. Children between the ages of 0 and 5 who come to those clinics receive a developmentally appropriate book at each clinic visit in their mother tongue. The book is accompanied by a bookmark and both oral and written information about the value of reading together. Our pamphlets were developed in-house, and we also use the CPS Developmental Milestones handout. One of the ways that we use to help young trainees who may not have much experience themselves to remember what to talk about is to post the CPS guidelines for promoting literacy in the offices where the clinic visits take place. As well as getting a book and some information about reading, families are also encouraged to visit the local library. In Quebec, we have a program called Une Naissance, Un Livre, and every baby who's born in the province can go to the library and get a new book as well, so they have more than one book. We've also created a list.
Jan, we've lost your audio. We don't hear you anymore. Oh, now you're back.
Okay, sorry. During these clinic visits, there's a great opportunity to really talk with families about any child language issues, and even with the parents about their own literacy issues. I really believe we would never have these conversations about parental literacy if it wasn't part of talking about reading with your child. And depending on that conversation, we may either refer the child to audiology or speech and language services, or perhaps the parent will be referred to adult literacy services. In Quebec, there's one number to call to find out about literacy resources anywhere in the province, and there are similar services throughout Canada. The pamphlets that are included with each book are developed in-house and available for parents with information to supplement the practitioner's advice about how to encourage reading with children. They're also made available. Storytime is the third part. Storytime is the third part of our intervention. We have a reading corner in our outpatient waiting room where volunteers read to children to model shared book reading and to help decrease the stress of waiting for appointments. And this has proven very popular. Our readers are mostly retired teachers and librarians and all receive training. As part of the Imagine Read, we really try to take other opportunities to get the whole hospital involved in thinking about literacy and the relationship of literacy and health. For example, every January we have a celebration of Family Literacy Day, which was started by ABC Canada many years ago. Through Family Literacy Day, we hope to raise awareness about literacy with all hospital staff and all families. Some of the activities include a presentation at Pediatric Grand Rounds by experts on different topics. If you go to our website, there's a link to the presentations at our last couple of grand rounds. Right at the bottom of our page, you'll see videos, and there's a presentation there about bilingualism and a presentation about the effects of screen media on children. They're both really excellent, and I think you might find them very helpful. Other activities that day include kiosks with community groups involved in literacy promotion, such as our public libraries, our patient education department, and many other activities around the city. And on that day, we offer free books not only to children from 0 to 5, but to children of all ages. We encourage hospital staff to come in and talk with us and meet the community groups by offering free refreshments, and there's a drawing for a gift certificate as a door prize. It's really a way for people who are not working in the clinics and with LEO to know about the resources available. The third example of literacy promotion is a project called Biblio Express. This is for inpatients. I'm sorry, we're practicing overhead. Once a week, 2 volunteers bring books to the families and children who are admitted to the wards and talk to those parents about reading. Many patients are young, and the parent's first response may be that he's too young. So the volunteer can give advice. One of the things that has happened is that having the book has shown to be helpful to many parents who are dealing with a sick child. In Biblio Express, they give out about 40 books a week. As far as our general organization of Live, Imagine, Read, I'm a part-time project coordinator. I work 1 day a week. We also have a hospital champion, Dr. Carolyn Erdos, who is a speech and language pathologist, and the medical champion is Dr. J. Marie Ferdinand. The coordinator role is quite complex and includes providing education and support to those who are seeing families in clinic, managing the volunteers, overseeing the program, ordering books, keeping statistics, participating in research, and fundraising. It's a lot to do in 1 day. I wanted to talk a little bit about what's covered in our educational module. I generally meet about 2 groups of mostly physicians a month. Topics that are covered are the definitions of literacy, the relationship of health and literacy to the relationship of health and literacy, the different programs that are in the hospital, and the resources that are available for the staff. It's really one thing to give books to children, but we don't want this to be just giving a gift of a book, rather something that helps families to know how books are important in their lives. And it's necessary for the people who are providing the information to know how to do so. We discuss why it's important for them to talk to families about reading, and we cover recommendations, some of the statistics and brain development that Dr. Shaw spoke about, the resources that are available, and we have some videos of pediatricians interacting with children that show how to talk to families about reading. We also talk about common questions that parents might have. I mentioned our last 2 grand rounds were talking about screen use with young children and bilingualism, and those are questions that oftentimes come up in the clinic visits, so having information about those topics are important. Another big question that comes up is how to engage my child in reading at that toddler age. And it's important for the clinicians to have some knowledge of how to do that. I just want to conclude by sharing a little bit of our experience with having such projects in a large tertiary hospital. We haven't, unfortunately, been able to do a formal evaluation, but we have held several staff focus groups, and we've gotten feedback from families that have really helped us to know what we need to do to improve the project. Our experience has been that we really need a paid coordinator. This may not be necessary in a small clinic or an office, but in a big hospital with so much turnover, we haven't been able to find a way to do it without a coordinator. We also feel strongly about providing mother tongue books wherever possible. I know that the research has shown that it's effective to give only English books. Obviously, in Quebec, that would really not be acceptable. We'd have to give English and French books. But when we have offered families who don't have a history of reading with their young children a book in their mother tongue, they take it very seriously, and they seem to be more open to reading when it is in their mother tongue. It's an opportunity to really encourage them to talk, speak, and sing in their language and not feel that they have to use a second language. I want to finish with just saying a few words about our challenges. Our funding is private, and we do worry each year that we'll lose it. The operational budgets of all hospitals are such that foundation money is needed oftentimes for basic things. But so far, so good. Working in isolation has been difficult, and I hope we can improve our programs by sharing ideas with all of you. The new staff all the time makes it really important to never stop talking about literacy promotion and why we need to do it. Even though Books for Babies was a very well-established program, when we moved to the new hospital this year and merged with another NICU, doubling not only patients but nursing staff, it was really hard to get it started again. Also, our clinic spaces were different, and it took time for the volunteers to become comfortable with the new setup and for us to find storage space. Time to do research has been really difficult too. We hope that by describing the background to literacy promotion in pediatric health centers and a description of a couple of the programs, that we've given you some ideas of how you may be able to do so too. We also hope that we can keep this conversation going. The Canadian Paediatric Society has a listserv, which we encourage everyone to join. You'll see the link here. And the Canadian Paediatric Society has also just started a survey. The link is here and will be available on the CAFC website as well. We're interested in knowing if people would be interested in having a national conference, if you have any other ideas about how we can proceed. And you can find our emails here. We'd be very happy to hear from you individually as well. Thank you very much.
Thank you, Jan. So 3 great presentations. Really gave us lots of information about the importance of health literacy starting it off, and then lots of options, particularly for our hospitals to get involved. We always hear about pediatricians and family physicians out in the community being interested in literacy, but this is some great examples of how our hospitals are getting involved in promoting this as well. So that's really excellent information to start with. We do have a few questions. So the one that came in was interesting, and we've had a couple people sort of touch on this, but I'd love to hear some more, your thoughts a little bit further on this. The comment that came in was someone talking about a program that they have in Manitoba to distribute books, and this is in Manitoba. They've distributed about 5,000 books through an ambulatory clinic with the goal of providing a library of 25 age-appropriate books to each child by the time they reach school age. He says, as you know, 25% of children in Manitoba are First Nations, much higher in the catchment area for their clinic. They're currently looking at ways of providing books in Indigenous languages, and he's curious to know how others are grappling with this. I know we heard, Carol, you mentioned that some books are provided in Mi'kmaq, and Jan, you talked about books being provided in mother tongue. Now, I wasn't sure if that included or how diverse the selection of Indigenous languages are that those are produced in. So maybe we'll start with Carol, since you did mention Mi'kmaq. Is it only Mi'kmaq, or do you have other Indigenous languages as well? I know that's probably the predominant language in Nova Scotia for you to deal with, but do you have any comments about that issue of providing books in Indigenous languages?
Yeah, I think it's incredibly important, and as you mentioned, in Nova Scotia, Mi'kmaq is the predominant First Nations language, and it is a language that is really struggling, and a language that the community is really working to keep alive. So we worked with the First Nations community to create a really wonderful Mi'kmaq Read to Me bag, and so that we also took a book, and we have the first Mi'kmaq board book. So it was a book that was translated into Mi'kmaq with the assistance of Bernie Francis, who is a expert linguist in the Mi'kmaq language, and Bernie also is a musician, and so as well as the book, one of the things that the elders on our committee felt was really important, because it is sort of a dying language, and a lot of the young families, the young parents, might not be able to read it. We also included a CD that was created in partnership with CBC, and so Bernie has songs and stories in Mi'kmaq on the CD. So it's a really lovely collection for families to start, even if they're feeling a little bit not feeling strong in the Mi'kmaq language. their babies, they're able to start reading to their babies in their first language right away.
And any thoughts from your perspective when you were talking about providing books in the mother tongue? Do you provide any selection of books in Indigenous languages?
At the Children's, we have a large population of Inuit families, and we do have several books in Inuktitut. And what we're really looking for now is Mohawk and Cree language books. Both of those languages are predominantly oral languages, and there really aren't a lot of books available, but we are working with those communities to try to find some that we could give out to parents. And we're also working on translating some of our pamphlets into those languages, at least, so that the families can receive the information in the language of their mother tongue.
All right. And Alyson, do you have any thoughts, anything to contribute to this one as well? I mean, from what you're doing in Ottawa here, I know we do have lots of, being in Ottawa as well, we do have lots of folks coming down from Nunavut for care at Chio from the Inuit population up there. Do you know of anything available in Ottawa from that perspective?
For our Inuit population, we started with our libraries, and we worked with the librarians to at least develop a list of Inuit language books that were available in the Ottawa library system. And then we were able to identify one or two titles from, I think it was Kids Can Press, and buy some books for those patients. But finding multilingual books continues to be a challenge.
Dr. Sharma, who's asking the question from Manitoba, he said, thanks for the language suggestions. He says they're developing texts in Cree, Ojibwe, and Oji-Cree using phonetic scripts to help the parents with pronunciation. So obviously lots of activity around that. It's great to see, but still lots of work to do.
I'd just like to add that I've recently just partnered with the Public Libraries of Montreal, and I'm working with them to develop sources of good children's literature in other languages. They don't purchase books through publishers, but rather through different bookstores. So unfortunately, it makes them a little bit more expensive, but we're looking into how we can use some of those books that are in other languages and are good books for young children. The other thing is that some of the books that we get are only in, let's say, Arabic or Urdu, and I try to get some of the residents who come from those countries to look at the books and just make sure that they're suitable. It's, again, more expensive to buy dual language books than single language books. And the parents don't necessarily need to read in the two languages, but we want to make sure that the books are reasonable and encourage the parents to enjoy reading with their children.
This is an important.
Go ahead.
It's an important question and unique in Canada in terms of the languages that that our patients speak as compared to the booklets that are available in the United States, for example. And that's one of the reasons we're hoping people will come together and consider joining the CPS listserv so that we can share ideas about book sources, particularly for unique populations.
Thank you. And Dr. Sharma put in another comment, but maybe we'll wrap up this piece about Indigenous languages with this, because we do have lots of other questions up there. But he's saying that they're working with Say It First Canada, whose founder, Mike Parkhill, was apparently just inducted into the Order of Canada for his work as a best-selling children's author and illustrator. And his books in Mi'kmaq, Ojibwe, and Cree are all have include phonetic translations, and he has about 12 titles already, which Dr. Sharma is suggesting are worth looking at. All right. So we'll move on to one of the questions that came in early on. Marianne was asking, as she says, as an early literacy specialist, do any of the presenters have advice on how to partner with and support physicians within our individual communities? Maybe we'll start with Alyson. Maybe we'll start with you. Any suggestions on how to support physicians within your communities?
I think even though physicians recognize that promoting literacy is important and they probably read with their own children, the literacy specialists can provide training for physicians so that they can feel more comfortable talking to families about literacy. Also, if the literacy specialists have sources of books that they can either give or recommend to the physicians, that's definitely a barrier for people promoting in their clinics. Sometimes it can be hard to get the physician's time and attention, but I think being persistent and offering the training and potentially some literacy resources for the clinic would help.
Carol, Jan, anything to add to that?
I'd just like to say that I think that when it comes to literacy in healthcare, it's really important to build some partnerships that may not have existed in the past. And I know with Read to Me, it's been really exciting to bring the library community together with the healthcare community. And we've seen some wonderful things happen as a result of bringing all of the partners together that may have been working in isolation before, and just that support and the way that that it then supports the child right from the birth at the hospital right out into the community with the with literacy groups and drop-in centers and libraries. So it's I think there's a lot to be gained by forging those partnerships.
Anything to add to that?
I agree with what Carol just said, but I also think that with meeting with a lot of physicians, what they say is finding the time to do this in their busy clinic visits. And one of the things we talk about is that it doesn't have to take a lot of time to talk about literacy, but my experience is that it's important for a clinic or an office where you are going to give out books, that there's an organizational process behind it. If the books are there, organized, ready to be given out with any anticipatory guidance, advocacy information already inside the book, the physicians will use it. I'm sorry for the overhead. But if they have to do a lot of extra work, there's just not time in those busy office visits to sort it out themselves. So I think it really takes a team, even in a clinic or an office, to make sure that the books are ready and easy to access.
All right, thank you for that. Great, and also, of course, always directing our physician colleagues to the CPS's information that we've already presented a number of times, the listserv, their position statements, et cetera, as a trusted source in the pediatrician community and throughout the medical community. I'm sure that would be, it would lend a lot of support to any arguments that you have for getting physicians to be paying attention to this. Providing the information from the Paediatric Society would certainly, I'm sure, be helpful.
That as well. Sometimes just having one physician who's on board and interested to present along with the literacy specialist as a literacy champion can help, because whether it's right or not, I think the physicians often pay attention when it's another physician that's giving them advice or has had success in their own clinic and sharing their experiences along with the expertise of the literacy specialist.
Yeah. And I did notice that Anne did put the link to the survey, the CPS Early Literacy Survey in the. I think you'll see it in your question box, and you might be able to click on that and take you directly to it, or you may have to cut and paste that URL into your browser. But it'd be great if everyone could help them out and and contribute your responses to that survey. This question was for Carol during your presentation, and Jan, you may have an answer for this too. She was just asking, Carol, how expensive your program is on an annual basis.
Well, our program reaches, as I said, between around 9,500 families. The average cost of the bag with all of the components, and we work very closely with publishers to get bulk discounts and to create a lot of our resources in-house. So we're able to provide a Read2Me bag to a family for approximately $15. And then the staff overhead is fairly low. So really it's just, and as I said, the IWK is the host organization providing our office space. So it's really the cost of the 2 full-time and 2 part-time staff to organize and administer the program province-wide. And then the cost of the bags per family is approximately $15 per family.
And Jan, do you have any numbers on what it costs to run the program at Montreal Children's?
Again, we're in a transition year going into a new hospital, so it's a little bit hard to say, but our annual cost for all 3 projects is about $50,000 a year, including all the books, all the 1 day a week coordinator salary, the support services like printing and all that. Everything is about $40,000 to $50,000 a year.
The next question that came in was from Jocelyn. She's suggesting the promotion of literacy for children with special needs is often put on the back burner due to other more pressing needs or medical priorities, or it's just low expectations perhaps for some of these kids. Do you have any tips or suggestions for how to bring the importance of early literacy to the forefront for children with special needs? So Jan, maybe we'll start with you. Jan, I'm not sure we can hear you. All right, maybe we'll go to Carol while Jan's getting her microphone tweaked there. So Carol, any thoughts for the children with special needs and how to make early literacy important for that group as well?
Mm-hmm. As I mentioned, we have books available in Braille and also signing books for families who are hearing impaired or visually impaired. And we also act as a resource for the IWK for any of the clinics if they have questions about books that would help in their clinic. They'll often come to the Read2Me program. So for instance, some of the OTs were looking for books that would support tummy time when they're talking to parents about the importance of tummy time, and we were able to give them a list of books for that.
All right. And Jan, do we have you back yet?
Yes, I'm sorry about that. Okay. I think your question was about books for special needs children?
That's right, yeah.
Okay. So I think it's really important to say that we choose books for the individual family and child that are developmentally appropriate, not necessarily age appropriate. We have a large population that we follow here at the children who have developmental needs, and of course they might not. The parents might not want to read to their biologically 6-year-old child a book that's for a 6-year-old. They would read a younger child's book. So we try to really pick a book that would be appropriate developmentally and perhaps have some connection to the child's interest. As far as for children who have hearing deficits, we try to encourage parents to use books with a lot of textures, things that the child can touch, flip pages, and books that have mirrors on them. And obviously the words in the book are not always important. It's really the telling the story in the way that the child would understand, either with the parent using sign language by looking at the pictures together. I think that's what I would say.
Yeah, no, that's great. Great advice. We did have a couple questions about accessing PowerPoint presentations and the recording as well. And yes, all of that stuff will be available after the presentation on the page that you can see on the screen there. We'll replace all that registration information with all of these resources, and some of the links that we've talked about today. We'll get some of that information up as well. Lindy's also asking is if there's a group in Calgary that is looking at developing a program for Alberta's children's hospitals. Are any of you aware of any activity in Alberta that we might be able to connect her with?
Sorry, I am not.
Okay. We did have a comment come in from Cecilia, who's saying Calgary Reads is looking at developing a program or has something in place. So that might be and she says they're working currently with Alberta Health Services. So there's one option right there. Thank you very much.
Vancouver and Winnipeg both have new programs as well, and they may be able to share some advice and information at that end of the country.
Yeah, okay. And Connie just put in a comment saying that Alberta Children's Hospital does have a program. So we'll certainly, if through the Family and Community Resource Center, she says, at Alberta Children's. So there we go. Lots of activity happening.
We'll have to talk to you.
Yeah, exactly. We did have a question come in for Carol about the Read to Me Endowment Fund, and just wondering how that was created.
Well, at the very beginning of the program, the organizers felt that it was important, rather than going year by year looking for annual funding, that the program be endowed so that it was secure and stable. And so, as I said, that's been a challenge because we also needed to find our annual funding while we were building that. And that's been a large part of my job is going out and into the community and to foundations and corporations to raise money for the endowment. And so it's getting close to being complete, close to being able to secure the program, but it's taken 15 years to build that. So that is that fundraising piece is an important piece.
Right. Thank you for that. We did have a question, sort of a comment that Lindsay has pointed out, just noticing that isolation was listed as a challenge for both the program in Nova Scotia and Montreal, that there's challenges there for isolated communities, etc. Do you know if there are any efforts to work together at a national level or a national organization that has taken any kind of lead at this across the country that some of these more isolated groups could tap into, perhaps in provinces where there isn't as established programs as we've had presented today? Is there anything happening at a national level?
There hasn't been to date, but we're certainly hoping that this webinar today will help start the discussion that will lead to that.
All right. Dr. Sharma.
Excuse me, if people will participate in the survey, we can know who we all are and also what the interest in, and hopefully we can move forward from there, because that's really our big goal after today.
All right. And the question just came in, how do people find out what is available locally? I mean, we just found out that there's someone from Alberta Children's who's looking to get involved in this and not aware that there's a program already in place. Perhaps the CPS listserv might be one of the better places to go for that? Or are there any other suggestions for how people would find out exactly what is happening locally?
On the CPS website, there is a list of different resources organized by province.
Okay, that would be very helpful. Any advice you can point us to how they can find that on the website?
Doug, can you hear me? It's Elizabeth from the CPS.
Yes, I can.
Can you hear me?
Okay. I can. I saw you pop into the list. I was going to mention that you were here, but I wasn't sure you were trying to sneak in without us knowing you were there.
Great. So just on our website, as Alyson mentioned, there is some literacy information. You just go under what we do and look under focus issues, and there's a page on early literacy there, and it's got contacts across the country, and a whole lot of other resources, many of which were mentioned today. And as people said, please do join the listserv and fill in the survey. One of the goals of the survey is to find out what the needs are across the country and to help connect people who are doing really great things, learn from others. So what we're trying to do now is get the word out that to have people identify that they are working on early literacy, specifically in health settings, help connect people and see what the needs are, and if there's a way that we as a national organization can help fill those needs or provide a catalyst for bringing people together or facilitating that conversation.
That's very helpful indeed. We did have another comment came in that's saying that as far as the national at the national level, Frontier College, Seeds of Empathy and Roots of Empathy, I know that they do more than just literacy. That's quite a broad program, but apparently literacy is one of their issues as well that they're interested in. So that's another place that you can just search. If you search for Seeds of Empathy or Roots of Empathy, you'll be able to find them very easily. And Dr. Sharma also put in a comment related to a little bit earlier discussion, but still very relevant, where he said, we have a partnership with the Winnipeg Public Library where kids in their clinic are given a coupon that will redeem as another free book if they visit their community library. They don't need to register, but their hope is that this will plug families into the community resource of the library and get people, give them a reason to go, and once they go that first time, it's probably more easy for them to continue to go. But so I think with that we'll start thinking about wrapping up, and because we are just about out of time, and I would like to just hear some closing thoughts from our panel. And Elizabeth, I'm gonna include you in that, and maybe we'll save you for the end, just to give the Canadian Paediatric Society's perspective here. But maybe we'll start in the order that we had our presenters, and just give any final thoughts or comments that you'd like to wrap up with, or leave the audience with as we wrap this session up. So we'll start with Dr. Alyson Shaw. Any final closing comments that you'd like to make?
I think the more I've been involved with this, the more I realize how much good work is happening across the country by so many different people and organizations who care about children and children's literacy. And I really do hope that talking about this today with such a wide audience is a catalyst for getting people to connect with each other so that we can start working towards a national strategy where we share our ideas and share our resources to do this effectively.
All right, thank you very much. And Carol, any thoughts from you as we wrap this up?
And I think what I would say would really just echo Dr. Shaw's comments. And over the 15 years that I've been working with 3to Me, I've seen so many wonderful programs be launched all over the country, and they may last a year or two, and sometimes very often they have to fold because of lack of funding and also working in isolation. So I'm really hoping that by connecting across the country we can share those resources and have a stronger voice so that the great work that gets started will be able to continue.
Thank you very much. And Jan? Uh-oh, Jan, we're not hearing you again. All right, well, perhaps we'll move on to Elizabeth. And just, Elizabeth, from the Canadian Paediatric Society's perspective, anything else that you would like to either direct them to, any resources that you have that weren't mentioned today, or anything else you'd like to leave the audience with?
Sure, thanks for the opportunity. Thanks to CAFC for taking an interest in this topic and helping us put this webinar together, and to the speakers. If you're not part of the listserv, please do join it. If you are part of the listserv, please use it as a way to communicate with each other. I know often you'll see our staff pushing out information, but it really is intended to be a tool to facilitate communication among all of you working in the field, so please feel free to use it. And if you're not sure, just just send out an email to the listserv and we'll help you get going. I'm going to send out after this call a link to the survey and to our literacy resources on our website across the listserv so that people have access to that.
Well, thank you very much, and it was our pleasure to do this. I mean, this was such a great presentation, as a lot of these issues are always so focused on sort of the community services or public health issues, and it's really a great opportunity to see what the hospitals can do to implement programs that really make a difference in this area. So thank you to all of our presenters, to Elizabeth and the Canadian Paediatric Society for all of their work in this area. It was a great presentation, and thank you to our audience for joining us. As we always do our webinars every Wednesday at 11 a.m. Eastern Time, and it's great when you guys can watch live, as your comments and suggestions and lots of the resources that were shared today have really benefited lots of others. We have a couple of people who are looking to get in contact with some of the people who were identifying some of the resources in the various areas, so we're going to try and connect some of you by email just so that you can find out what is available and get in contact with those who know about these programs in your area. Our next webinar is actually on Friday, April 22nd, which is one of our patients from the Pediatric Patient Safety Collaborative at CAFC. And that next presentation is titled Say Yes to the Less, or if you are familiar with the show Say Yes to the Dress, it's a little play on that. And we're going to be hearing from Dr. Jeremy Friedman from the Hospital for Sick Children. And he's going to be talking about the Choosing Wisely campaign, which is a campaign to help physicians and patients engage in conversations about unnecessary tests and treatments and procedures. And Choosing Wisely, the recommendations that they are coming forward with are mostly aimed at adults, and the Hospital for Sick Children is going to join us to talk about how they created their own top 5 list tailored specifically for the children that they see at their hospital and how to reduce unnecessary procedures and tests. So that should be a really interesting presentation on Friday. And then next week on Wednesday in our regular CAFC Presents session, we'll be we partnered with Immunize Canada to bring a session called Immunization, Beyond Coverage Monitoring and the Role for Pediatric Health Centers. And we're going to hear from Nicholas Gilbert from the Public Health Agency of Canada, and also from Dr. Marina Salvadori from London, from the Children's Hospital at London Health Sciences in London, Ontario, to talk about the 2013 Childhood National Immunization Coverage Survey to give us a sense of the state of immunization coverage in Canada. And from there we'll be hearing from Dr. Salvadori to talk about the hospital perspective and why our pediatric health centers could and should be taking more of a leadership role in immunization, particularly as it relates to medically complex children and children with significant disabilities that are often seen at not necessarily just in the community but in our children's hospitals or rehab centers across the country. So, and just really explaining to us why those centers should be taking more interest in the role of immunization. So some great stuff coming up. Thanks again to our audience and to our presenters for a great presentation today, and we hope to see you back here next week. Bye, everyone.